Many of you know by now that in general, hormone replacement therapy has been shown to be safe through many, many studies. This is a position statement recently from the North American Menopause Society talking about how safe it is for women under the age of 60 to get relief of menopause symptoms using hormone replacement therapy. And in general, I totally agree with this. Hormone replacement therapy can not only make you feel better, but it can be life-saving, reducing the risk of things like colon cancer and heart disease if it started early, pretty immediately after menopause. However, one complication, venous thromboembolism or blood clots of the lung or legs, can be a life-threatening complication of hormone replacement therapy. I've talked previously about how I test for the genetic risks for having an increased risk of blood clots in the legs or the lungs, what's called an increased risk of VTE or venous thromboembolism, through checking for factor V Leiden and factor II before starting patients on hormone replacement therapy. I have had some experts actually take issue with this and mention that this is not a real contraindication to having hormone replacement therapy. In general, I would agree that this is not an absolute reason or an absolute contraindication not to have hormone therapy, but I do think that if you are going to have hormone replacement therapy, it's important that you know about this genetic risk in making your decision. This article from the position statement from the North American Menopause Society simply says more study is needed on this topic. However, there are some studies. Subgroup analyses of some studies then before 2002 showed an increased risk of blood clots in the legs and lungs in women who had the factor V Leiden mutation versus women who did not. The risk seemed to be about 6% of developing a blood clot in women who did not have this mutation on hormone replacement therapy versus 14% for women who did have this mutation. So although I would not stop someone absolutely from getting hormone replacement if they have one of these mutations, I do think it is really important to know that you have it and to know the risks and to be absolutely clear about this. For instance, if you have hormone replacement therapy going on and you're going to be at a higher risk of blood clots, for instance, if you're flying or if you're going to have surgery, this might change your behavior. For instance, you might get up and walk when you're going on flights. You might consider even speaking to your doctor about whether you have 2 copies of the factor V Leiden mutation and might benefit from some prophylaxis when you're flying. Would you need to have different ways of treating you post-surgery to reduce your risk? So these are all things that are important to know. Although further study is needed, I feel like knowing this information is very important if you're going to have hormone replacement therapy. This has been Dr. M.